So good evening to all of you. I'm Dr. Pradeep Pawar, Professor of Anatomy, having a vast experience of teaching anatomy for the undergraduates as well as the postgraduate students, the postgraduate entrance students, India and abroad. So let us start with today's session. It's a mixed bag for the NEET. Good evening, good evening. Mixed bag for the NEET students. Okay, so the students will start. One MCQ, one visual. Yeah. Starting here. Just go through the MCQ, answer this, then we discuss. Good evening, Rishi. Yes, students, answer. I'm looking at the screen. Come on, students. You can crack this MCQ. So I'll start. A 26 years old man comes to the physician for follow-up examination. 2 weeks ago, he was treated in an emergency department for head trauma after being hit by a bicycle while crossing the street. Okay, so that's a head trauma. Neurological examination shows decreased taste on the right anterior. Who's this? Who's going to carry taste sensations from the anterior 2/3 of the tongue? Students, what is that? That's chorda tympani. Very good, Rishi. And this chorda tympani is a branch of what? Facial. The chorda tympani is a branch of facial. The patient's condition is most likely caused by damage to a cranial nerve that is also responsible for which of the following? Yes, Sairam. So this is going to be B, eyelid closure. So that's the facial nerve. And yes, all the muscles of facial expression or all the muscles of the second pharyngeal arch would be supplied by the facial nerve, correct? Because the nerve of the second pharyngeal arch is facial and all the muscles derived from the second pharyngeal arch are therefore supplied by the facial nerve. Can anyone tell me what is the name of the nucleus of the facial nerve which is going to supply the muscles of the second pharyngeal arch? Come on, students, the question is there for you. What is the name of the nucleus of the facial nerve which is going to supply the muscles of second pharyngeal arch? Yes. Anyone? What is the name of the nucleus of facial nerve? Can anyone answer this? MCQ? Can anyone answer this? The name of the nucleus of facial nerve which is going to supply the muscles of second pharyngeal arch? Yes, that's the motor nucleus of facial nerve. Motor nucleus of facial nerve. And where is this motor nucleus of facial nerve located? Can anyone answer? The motor nucleus of facial nerve is located in the pons. In the pons. You know, the fibers of facial nerve, they wind around the abducens nucleus. The fibers of facial nerve, they go around the abducens nucleus and they form elevations, not nucleus ambiguous. No, not nucleus ambiguous. The fibers of facial nerve, okay, I'll just make this for you. Look at this. So it's the motor nucleus of facial nerve. Students, the motor nucleus of facial nerve, and this motor nucleus of facial nerve, if you can answer this, look. Okay. So this is the nucleus of abducens nerve here. That's the nucleus of abducens nerve. And these are the fibers of abducens nerve. And if anyone can tell me what is this nucleus of? That's the motor nucleus of facial nerve. Students, and this motor nucleus of facial nerve, the fibers of facial nerve, they turn around the abducens nucleus and get out. Correct? The fibers of facial nerve, they wind around the abducens nucleus and get out. And as they wind around the abducens nucleus, they're going to form elevations here. They're going to form elevation here in the pons. And this is what we call as the facial colliculus. That's the facial colliculus, right? So this facial colliculus is formed by what? The fibers of facial nerve as they turn around the abducens nucleus. And this nucleus of facial nerve is known as the motor nucleus of facial nerve. And this motor nucleus of facial nerve is going to supply the muscles of second pharyngeal arch. Correct? So that's the motor nucleus. And which part of the pons is this? This is the lower half. lower half of the pons. Lower half of the pons. That's the lower half of the pons. Perfect. Okay, clear? I'll clear this, huh? I'll clear this. So coming back here. So fine. So facial sensations. Can anyone tell me which is the nerve which supplies the sensations of the face, or sensations, who carries sensations from the face? Yes, students, answer. Yes, hello to all of you. Hello, good evening. Answer, try to answer, students. Be interactive. Huh? The more you interactive you are, the more I'll be able to tell you. So which is the nerve which is going to supply sensory supply to the face? Yes, anyone? The nerve which supplies the face, sensory supply, is the trigeminal nerve. Very good, trigeminal nerve. And what are the 5 branches of trigeminal nerve? I mean, what are the 3 branches of trigeminal nerve? I'll just make a slide for you, students. See if you can answer this. This is a very important MCQ. This you should know. That's the body of the mandible, students. That's the ramus of the mandible. And what is this junction known as between the body and the ramus? This is what we call as the angle of the mandible. Angle. Who's going to supply this much part of the face? Sensory supply. That's the ophthalmic division of trigeminal nerve. Who's going to supply this part of the face? The maxillary division of trigeminal nerve. And this would be supplied by the mandibular division of trigeminal nerve. That means the entire face sensory nerve supply is carried by whom? The trigeminal nerve. Through its 3 divisions, the ophthalmic, the maxillary and mandibular, except the skin over the angle of mandible. Students, the skin over the angle of mandible, and this is supplied by whom? Greater auricular nerve. Greater auricular nerve, yes. This is supplied by the greater auricular nerve. And this greater auricular nerve is a branch of cervical plexus. It's a branch of cervical plexus. The greater auricular nerve is a branch of cervical plexus. If you can quickly tell me, what are the branches of ophthalmic division? Look, this much part is supplied by the ophthalmic nerve. Doesn't mean ophthalmic nerve itself supplies. It gives branches. If you can quickly answer this, what is this branch? This is the supraorbital. Supraorbital. What is this nerve? This is the supratrochlear nerve. So supraorbital, supratrochlear. What is this nerve? Infratrochlear. The nerve supplying the tip of the nose. This is a very important MCQ. Nerve supplying the tip of the nose. That's external nasal nerve. External nasal. And there's a gland here. Students, what is this gland known as? Lacrimal gland. The name of the nerve is lacrimal nerve. Lacrimal. So what are the branches of ophthalmic division? That's the supraorbital. That's the supratrochlear. That's the infratrochlear. That's the external nasal, and that's the lacrimal nerve. Lacrimal. Perfect. So that's about the ophthalmic division. What is this nerve? That's the maxillary division. What are the branches from the maxillary division? Look, I'll just quickly enumerate this for you. Now, that's the orbit, bacha. That's the orbit. And there's a foramen right below the orbit. Name. Infraorbital foramen. And the nerve which emerges from this infraorbital foramen is the infraorbital nerve. Infraorbital nerve. Now, there's a nerve which supplies the skin over the zygomatic area and the face. What do we call this as? Zygomaticofacial. And the nerve which supplies the skin over the zygomatic and the temporal regions. Zygomaticotemporal nerve. So this is zygomaticofacial and this is the zygomaticotemporal nerve. Perfect? Yes. Yes. And now coming to the mandibular division. Mandibular division of trigeminal nerve, students. Let us just finish this mandibular division. Now there's a foramen right here. What is this foramen? Mental foramen. The nerve coming out from here is the mental nerve. That's the mental nerve. There's a nerve which is going to supply the skin over the auricle and the temporal regions. What is that? Auriculotemporal nerve. Auriculotemporal. And there's one nerve which is known as the buccal nerve. That's the buccal nerve. Okay, I just put the first letters there. I hope this is clear. So the mandibular division of trigeminal nerve, 3 branches. One is mental, one is buccal, and one is the auriculotemporal nerve. So is this clear to all of you? So the entire face is supplied by trigeminal nerve except the skin over the angle of mandible, which is supplied by greater auricular nerve. Greater auricular nerve. Huh? What happened? Yes, Dr. Pal. Facial nerve ka location. Facial nerve ka location. What do you want? Exactly. Facial nerve. Okay. Very good. Very good. Chalo, this is fine. So that's about the trigeminal nerve. Coming back to our MCQ. So facial sensation is by the trigeminal nerve. Perfect to all of you. Right. This is by the trigeminal nerve. Tongue protrusion. Can anyone tell me who's going to protrude the tongue? Students, which is the nerve going to protrude the tongue? And this muscle is therefore known as the safety muscle of the tongue. The muscle which is going to protrude the tongue prevents the falling back of the tongue. Can anyone answer this? This muscle is the genioglossus. Genioglossus. Okay, that's the genioglossus. And genioglossus is therefore known as the safety muscle of the tongue. Safety muscle. Genioglossus. And parotid gland salivation. Parotid gland salivation. Yes, very good. Which is the cranial nerve which is going to supply the parotid? Can anyone answer this? The cranial nerve supplying the parotid. That's the glossopharyngeal nerve. Glossopharyngeal nerve supplies the parotid gland. Quickly, if you can just enumerate, the glossopharyngeal nerve. What is the name of the nucleus of glossopharyngeal nerve? That's the inferior salivatory nucleus. Inferior salivatory nucleus, that's the nucleus of glossopharyngeal nerve. Okay, that's the nucleus of glossopharyngeal nerve. It's tympanic branch of glossopharyngeal nerve. What is the tympanic branch of glossopharyngeal nerve known as? Anyone? The tympanic branch is known as the Jacobson's nerve. Jacobson's nerve. Now this tympanic branch joins with the sympathetic plexus. The tympanic branch joins with the sympathetic plexus and forms the good evening, and forms the tympanic plexus. Tympanic plexus. I'm just telling you the nerve supply of parotid gland. Which is the cranial nerve supplying the parotid gland? Yes, good evening. The cranial nerve supplying the parotid gland is the glossopharyngeal nerve. What is the name of the nucleus of glossopharyngeal nerve to supply the parotid gland? That's the inferior salivatory nucleus. Inferior salivatory nucleus. You get the tympanic branch of glossopharyngeal nerve, which is known as the Jacobson's nerve, joins with the sympathetic plexus, forms the tympanic plexus. From the tympanic plexus, we get a nerve, that's the lesser petrosal nerve. Lesser petrosal nerve. The lesser petrosal nerve emerges out from the foramen ovale, goes to a ganglion, that's the otic ganglion, and the fibers would now go to the parotid gland. The fibers would now go to the parotid gland. And you know who's going to carry this fibers to the parotid gland, students? Which is this nerve which is going to carry the fibers to the parotid gland? Auriculotemporal nerve. These fibers are carried by the auriculotemporal nerve. Just remember this. The fibers are carried by auriculotemporal nerve. No, it doesn't mean auriculotemporal nerve supplies the parotid. No, auriculotemporal nerve just carries the postganglionic fibers to the parotid gland. And students, when there's a lesion of the skin over the parotid gland, just understand this. When there's a perforating lesion of the skin over the parotid gland, during regeneration, there's a mixing of fibers. There's a mixing of fibers of two nerves. The fibers of the auriculotemporal nerve gets mixed with the fibers of, can anyone answer this? The fibers of auriculotemporal nerve gets mixed with the fibers of, yes, very good Upendra. The fibers of greater auricular nerve. The greater auricular nerve is also going to supply the sweat glands, correct? It supplies the sweat glands. So there's a mixing of fibers. The fibers of auriculotemporal nerve gets mixed with the fibers of greater auricular nerve. And now when a person salivates, the person starts to get sweating of the skin over the parotid gland. And this is what we call as Frey's syndrome. Yes, very good Upendra. This is what we call as Frey's syndrome. Yes, Sairam. Very good to all of you. Yes, you've answered well. Clear to all? This MCQ is clear. The options also we have discussed in details. Okay, good. And you tell me crocodile tears involve which two glands? This is Frey's syndrome. Now crocodile tears involve which two glands? Which two glands? Crocodile tears. They involve the submandibular and the lacrimal gland. The submandibular and the lacrimal gland. What are crocodile tears? When a person salivates, the person starts to get tears, and that is crocodile tears. And that is seen in lesions of facial nerve. Crocodile tears. Which two glands are involved? The submandibular gland and the lacrimal gland. The submandibular and the lacrimal gland. Is this clear? Coming to the second MCQ. Here we are. If you can answer this. Very good. This you should know. Anyone? Come on students, you can crack this MCQ. Yes, very good, Sairam. Sairam has answered it. Yes. See, how do you remember this? Yes, very good. Ulcers are very common in which part of the duodenum? First part. First part of the duodenum, ulcers are common. Which wall of the first part? The posterior wall of the first part. And immediately behind the first part of the duodenum, what is the artery there? That's the gastroduodenal artery. That's the gastroduodenal artery behind the first part of the duodenum. So this gastroduodenal artery is eroded, leading to melena. Okay, very good. That's the gastroduodenal artery. Just have a look at this MCQ. Just have a look at this slide. Look, students, this is a very important slide. Now see here. The duodenum has come slightly down. We have cut the duodenum. The first part has come slightly down. If I place the duodenum like this, just have a look. If I place the duodenum like this, I'm just making the duodenum like this. So now you tell me, what is this part of the portal vein? What is this part of the portal vein? Above the first part of the duodenum, this is the supraduodenal part of the portal vein. What is this part of the portal vein? Behind the duodenum, that's the retroduodenal part of the portal vein. And what is this part of the portal vein? Below the first part of the duodenum, that's the infraduodenal part of the portal vein. Okay, just a small thing I'll tell you about this portal vein. So that's the first part of the duodenum. That's the supraduodenal, retro and infraduodenal part of the portal vein. Fine. So students, if you can tell me the supraduodenal part of the portal vein, there's something which is present between the liver and that's the stomach here like this. There's something which is present between the liver and the lesser curvature of stomach. What is that? Lesser omentum. Lesser omentum. Between this liver and the lesser curvature of the stomach, what is cut here? That's the lesser omentum. And what is present within the lesser omentum? There are three structures. The hepatic artery, the portal vein and the bile duct. Okay. Hepatic artery, portal vein and bile duct. Out of these three structures, who's the most posterior? That's a very important MCQ for you. Can anyone answer this? Out of this four, out of this three, who's the most posterior one? I've just magnified this for you. The portal vein. The portal vein. See, in the lesser omentum, there are three structures: hepatic artery, portal vein, and bile duct. Out of this three, no, you didn't get the question. Out of this three, hepatic artery, portal vein, and bile duct, ये तीनों में who's the most posterior one, students? The portal vein is the most posterior one. Portal vein, सबसे पीछे, portal vein. Now, this is the portal vein. Who's to the right of the portal vein? Who's to the right of the portal vein? The bile duct. Who's to the left of the portal vein? Here, that's the hepatic artery. That's the hepatic artery. And who's behind the portal vein? What's that? That's the IVC. That's the IVC. Just understand this slide. There are plenty of things in this single slide. Just try to understand this. So the supraduodenal part of the portal vein, what are the relations of the supraduodenal part of the portal vein? To the right is the bile duct. To the left is the hepatic artery. Posterior is the IVC. And students, there's a foramen right here. Can anyone identify this foramen? Here, where the hand is. That foramen is the epiploid foramen. Here is the epiploid foramen. And that's how epiploid foramen ka posterior boundary would be formed by what? The posterior boundary of the epiploid foramen is formed by IVC. The anterior boundary of the epiploid foramen, the immediate anterior boundary of the epiploid foramen would be formed by portal vein. That would be the portal vein, immediate anterior. But when we say anterior boundary, we generally say lesser omentum containing hepatic artery, portal vein and bile duct because they are together. But if you have to select one, we select it as portal vein. Portal vein. Perfect. That's the supraduodenal part of the portal vein. Coming here, students, what is this part of the portal vein? That's the retroduodenal part of the portal vein, and automatically this becomes the posterior relations of the first part of duodenum. So the retroduodenal part of the portal vein, who's to the right? Who's to the right? Bile duct, bile duct. Who's to the left? If you compare the bile duct, this will be to the left. If bile duct is on the right, this is comparatively left, and that's the gastroduodenal artery. So relations of the portal vein, the retroduodenal part of the portal vein, to the right is the bile duct, comparatively left is the gastroduodenal artery, and posterior to the portal vein is IVC. Very good. Posterior to the portal vein is the IVC. And coming down, what is this part of the portal vein here? This part of the portal vein is the infraduodenal part. And what is anterior to the infraduodenal part of the portal vein? What is this going to be? Which part of the pancreas is this, students? The neck of the pancreas. That's the neck of the pancreas. And posterior to the portal vein is the IVC. IVC. Look, I will explain you the entire portal vein. This is extremely important, students. This is extremely important. Look, once again, I'll tell you. Posterior relation of portal vein kya hai? In its entire extent, means supraduodenal part, retroduodenal part, infraduodenal part of the portal vein. Who's behind? Who's behind? IVC. One thing should be perfectly clear. IVC. Right? Just understand the supraduodenal part of the portal vein. To the right, bile duct. To the left, hepatic artery. Right is bile duct, left is hepatic artery, posterior is IVC. Retroduodenal part. To the right, bile duct. To the left, gastroduodenal artery. Posterior, IVC. Infraduodenal part of the portal vein. Anterior, that's the neck of the pancreas. Posterior is the IVC. That's how you should be able to understand this portal vein. Clear? So I finished the entire portal vein for you. Student, this is a very important visual slide. इसमें बहुत कुछ है. Just try to understand what are possible from my side. I'm trying to tell you. Perfect. Perfect. Can anyone tell me what is this structure? Look, what is this structure? Who's this structure? Who's crossing the pancreas like this? And the second part of duodenum. Can anyone tell me? What is this organ which is crossing the entire pancreas and the second part of duodenum? Yes. Can anyone answer this? You can see that. You can see this impression here. Huh. Come on, come on, come on. I'm waiting for your answer. What is this structure? Anyone? Mesentery nahi hai bacha. It's not mesentery. That's the mesentery of transverse colon. Okay. Okay. What do you call that as? What is the mesentery of transverse colon known as? It is known as the transverse mesocolon. Transverse mesocolon. Very good. This thing which is crossing the pancreas through and through is the transverse colon, not the stomach, not the stomach. Ye hai ye, transverse colon. In front of the transverse colon is stomach. In front, मतलब transverse colon के आगे is the stomach. So the first organ is the stomach. Behind the stomach is the transverse colon. Behind the transverse colon is going to be the pancreas. Pancreas. So the anterior relation of the second part of the duodenum, is transverse colon and mesocolon. The entire pancreas is crossed by whom? The transverse colon and the mesocolon. It's not root of mesentery. This is not root of mesentery. Perfect. Can anyone tell me what is this? What is this? There are plenty of things in this slide, so I'm just trying to make it clear about this. This is a visual slide for you students. Remember, what is this? Can anyone comment on this? What is this that I'm pointing? Bolo. I'm looking at the screen. Anyone? This is the falciform ligament. This is the falciform ligament. And falciform ligament is a fold of peritoneum, students. Falciform ligament is a fold of peritoneum from the anterior abdominal wall to the liver. From the anterior abdominal wall to the liver. Yes, very good to all of you. This is the falciform ligament. And can anyone tell me what is this structure within the falciform ligament? Here. What is this rounded structure within the falciform ligament? That's the ligamentum teres. You can see this beautiful thing here. That's the ligamentum teres. Students, look here. That's the ligamentum teres. Ye hai falciform ligament, and in the falciform ligament is the ligamentum teres. And what is ligamentum teres? Yes, round ligament of liver. Very good. What is ligamentum teres? The other content of falciform ligament is paraumbilical vein. The other content is paraumbilical vein. But what I'm showing you is the ligamentum teres. And what is ligamentum teres? It is the obliterated left umbilical vein. The obliterated left umbilical vein becomes the ligamentum teres. Remember this. The obliterated left umbilical vein is the ligamentum teres. Is this clear to all of you, students? And can anyone tell me what is this? Look, what is this structure that I'm pointing? This one. Ductus venosus nahi. It's the obliterated, that's the obliterated left umbilical vein. That's the obliterated left umbilical vein. Yes. Students, you tell me what is this? Another very important visual slide for you. You can see this? Barabar hai, Upendra, that's right, that's fine. Yes, what is this, you tell me? Upendra Gaikwad, very good. Yes, all of you, answer what is this structure? Can anyone comment on this? This should be clear. This you have to know. Anyone? Any guesses? If this comes as a visual slide and if this is pointed to you, what do you identify this as? I'll give you one hint. Students, I'll give you one hint. This is included in the stomach bed. This is one of the structures lying in the stomach bed. Yes, now come on, answer. You can crack this. This is something which lies in the stomach bed. Thoracic duct nahi hai, bacha. It's not thoracic duct. No. Find your answer. So now, once you answer, your concepts will be clear. Don't hesitate. Even if it is wrong, that's fine. We are here to clear your doubts. This structure is the diaphragm. Very good. You got this. This is the diaphragm. And which part of the diaphragm is this? What do you call this as? This is the left crus of the diaphragm. That's the left crus of the diaphragm. Why did you retract, bacha? That's right. This is diaphragm. Very good. This is the left crus of the diaphragm. This is the left crus of the diaphragm. And if anyone can tell me the left crus of the diaphragm is derived from what? This left crus of the diaphragm lies below the stomach. It is one of the structures in the stomach bed. The left crus of the diaphragm is derived from, I'm asking its development. Can you comment on this? The left crus of the diaphragm is derived from, it's a spot. Dorsal mesentery of the esophagus. Dorsal mesentery of the esophagus. The crus of the diaphragm is derived from the dorsal mesentery of the esophagus. Clear to all of you? Dorsal mesentery. Chalo students, quickly you identify this big artery. This big artery. Whatever is there in the slide I'm showing you. What is this big artery? Anyone? What is this big artery? That's the celiac trunk. That's the celiac trunk. And these are the three branches of celiac trunk. That's the left gastric artery. That's the left gastric. That's the splenic artery. Splenic. And that's the common hepatic artery. Common hepatic. So that's the celiac trunk. That's the left gastric. That's the splenic artery. And that's the common hepatic artery. Common hepatic. Clear? So splenic artery runs on the superior border of the body of the pancreas. It gives branches to the pancreas. These are the pancreatic branches. It gives branches to supply the fundus of the stomach. Yes, these are the short gastric branches. And it gives an artery which runs along the greater curvature of the stomach. What do you call this artery as? The left gastroepiploic artery. That's the left gastroepiploic artery. Clear? So the splenic artery gives pancreatic branches here, short gastric branches here, and the left gastroepiploic artery. This is perfectly clear, the crystal clear to all of you. Can you tell me what is this part of the pancreas on which this vessels are lying? What is the part of the pancreas on this vessels lie? Yes, anyone? What are these two vessels here? That's the superior mesenteric artery and that's the superior mesenteric vein. Which part of the pancreas are they related to? Uncinate process, very good. Uncinate process, neck. This is the uncinate process. The superior mesenteric artery and vein are related to the uncinate process, and the same superior mesenteric artery and vein are going to cross the third part of duodenum. The third part of the duodenum. So anterior relations of the third part of the duodenum is going to be what? The superior mesenteric vessels. The superior mesenteric vessels. And who's going to be behind the third part of the duodenum? The aorta, the abdominal aorta, right? So the third part of the duodenum lies between what and what? The superior mesenteric artery and the aorta, and this third part can get compressed between the superior mesenteric artery and the aorta, and this is what we call as Wilkie's syndrome or the superior mesenteric artery syndrome. Superior mesenteric artery syndrome. Perfect. Clear. Just one last thing in the slide. What is this for the gallbladder? Students, what is this for the gallbladder? That's the fundus. And what is this for the gallbladder? The body of the gallbladder. Now what we have done is we have taken the lever up like this, students. We have lifted the lever up to see the structures. I place the lever back in its position. Suppose if we place the lever back in its position, the fundus of the gallbladder would lie on what? The fundus of the gallbladder would be lying on what? Or the fundus of the gallbladder would be related to what? This you should know. And the body of the gallbladder would be related to what? It will just come like this, like this, like this, like this, like this. So the fundus would be related to what? The body would be related to which organ? Come on students, you can crack this. The fundus of the gallbladder is related to transverse colon. Yay, this is transverse colon like this. The transverse colon goes like this. So if I place it back, the fundus would come to lie exactly over the transverse colon and the body would come to lie over the first part of the duodenum. The body would come to lie over the first part of the duodenum and the fundus comes to lie on the transverse colon. So anterior relations of the first part of the duodenum therefore becomes the body of the gallbladder, and the posterior relations of the first part of duodenum becomes the gastroduodenal artery, the bile duct and the portal vein. Okay, fine. We have discussed a lot on this slide. Clear now students? Is this clear or no? See, once again, the fundus of the gallbladder comes to lie on the transverse process and the body would be related to the first part of the duodenum. So, anterior relation of first part of the duodenum is going to be the fundus. The posterior relation of the first part will be the bile duct, the gastroduodenal artery and the portal vein. Perfect. Excellent. Very good to all of you. Good students. Let us now proceed to the next slide. Here we are. Very good. Here we go to the next slide. Answer the students. Anyone? A student gets into a pencil and rolling pin fight with his friend. He seizes the upper hand and quickly stabs his pencil through the student's medial carpals. That means the child holds the hand and stabs the pencil into his carpals on the medial aspect. He was also lucky to sever one of the student's nerves. That means one of the nerve is damaged. The student can now perform which of the following? So he is stabbed on the medial aspect of the carpals. Which is the nerve related to the medial aspect? Which is a nerve related to the medial aspect? Ulnar nerve. Ulnar nerve. The nerve on the medial aspect of the carpal bones is ulnar nerve. The ulnar nerve passes through a tunnel. Can anyone tell me what is the name of the tunnel? Ulnar nerve passes through the Guyon's tunnel. Median nahi hai bacha, it's ulnar nerve. Ulnar hai wo. Ulnar nerve passes through the Guyon's tunnel. Guyon's tunnel, and the ulnar nerve is injured here. So tell me, adduction of thumb. Very good, very good. Very good to all of you. If you can quickly tell me, adduction of the thumb is done by whom? Yep. Adduction of the thumb is done by adductor pollicis muscle. Adductor pollicis. And adductor pollicis is supplied by whom? Ulnar nerve. Adductor pollicis is supplied by ulnar nerve. In fact, adductor pollicis is also known as what? Adductor pollicis is known as the graveyard. You must be knowing this. Graveyard of ulnar nerve. Graveyard of ulnar nerve. Adductor pollicis is known as graveyard of ulnar nerve. Why, students? Why? Adduction of thumb is done by adductor pollicis, and this adductor pollicis is supplied by ulnar nerve. Why is the adductor pollicis known as graveyard of ulnar nerve? Because after supplying so many muscles, after supplying this 15 muscles of the hand, the ulnar nerve goes and buries itself. It ends in the adductor pollicis muscle. Okay, it goes and buries itself in the adductor pollicis, and that is why it is known as the graveyard of ulnar nerve. Very good, very good. Graveyard of ulnar nerve. Who's going to adduct the fingers, students? Adduction of fingers is done by whom? Adduction. Adduction of fingers is done by palmar intraossei. Yes. Palmar intraossei. Adduction of fingers is done by palmar intraossei, and all the palmar, and abduction of fingers is done by dorsal intraossei. Abduction is done by dorsal intraossei. Both palmar and dorsal intraossei are supplied by whom? Ulnar nerve. Both palmar and dorsal intraossei are supplied by ulnar nerve. So answer is opposition of thumb. Opposition of thumb is done by whom? Opponent's pollicis. And opponent's pollicis is supplied only by medial nerve. Remember that. Opponent's pollicis is only supplied by medial nerve. That is why opposition of thumb will be intact. Opposition of thumb will be intact. Students, come on, let us discuss something very important. See if you can answer this. It will be an added advantage for you. Let us understand the movements of the thumb. Taking advantage of this MCQ that we have just answered, if you can quickly tell me the movements of the thumb. Chalo students, I'll start. What is this for the thumb? Yo. What is this for the thumb? Flexion. What is this for the thumb? Extension. What is this for the thumb? Abduction. What is this for the thumb? Adduction. And what's that? Opposition. Come on, you tell me this. You get plenty of MCQs on this muscles of the thumb, the nerve supply. So always there's a confusion. Let me just quickly, enumerate this. We'll start with, what would we start with? Tell me. We'll start with flexion of the thumb. Flexion. Tell me which are the muscles which does flexion at the thumb. Come on students, you can answer this. Flexion of the thumb is done by flexor pollicis longus, flexor pollicis longus, flexor pollicis brevis. I'll just write the initials. Flexor pollicis longus, flexor pollicis brevis. Can anyone tell me what is the nerve supply of flexor pollicis longus, students? Can anyone tell me what is the nerve supply of flexor pollicis longus? Come on students, come on. You can crack this. Flexor pollicis longus is supplied by whom? Yes? Flexor pollicis longus is supplied by anyone? Flexor pollicis longus is a muscle of the forearm. Yo. It's a muscle of the forearm. And which is the nerve which is going to supply the flexor pollicis longus? Come on, guess students, guess. Who's going to supply the flexor pollicis longus? That's the anterior interosseous nerve. Anterior interosseous nerve, which is a branch of median nerve. Anterior interosseous nerve, which is a branch of median nerve. Who supplies the flexor pollicis brevis? Flexor pollicis brevis ka superficial head. This is very important. See, in a nutshell, you will get everything. Superficial head is supplied by medial nerve. And the deep head is supplied by ulnar nerve. So flexor pollicis brevis has got two heads. The superficial head is supplied by median nerve and the deep head is supplied by ulnar nerve. So that's about flexion of the thumb. Flexion of the thumb, flexor pollicis longus, anterior introsus nerve, that's a branch of median. Flexor pollicis brevis के दो heads हैं, superficial and deep. The superficial head is supplied by median, the deep head is supplied by ulnar nerve. Okay, coming to extension of the thumb. Extension. Students, can you answer this? Extension of the thumb is done by what? Extensor pollicis longus and extensor pollicis brevis. Extensor pollicis longus, extensor pollicis brevis. Who's going to supply this? 2. Where is the extensor pollicis longus and brevis located? On the dorsal aspect of forearm. Dorsal aspect of the forearm. The nerve is posterior introsus nerve. Posterior introsus nerve. Extension is done by extensor pollicis longus, extensor pollicis brevis. The nerve is posterior introsus nerve. Flexion extension is over. Abduction. Abduction of the thumb is done by abductor pollicis longus, abductor pollicis brevis. Both are supplied by, both are backside. They are supplied by posterior introsus nerve. Abductor pollicis longus and abductor pollicis brevis जो है, abductor pollicis brevis. Abductor pollicis longus is supplied by posterior introsus nerve. Abductor pollicis brevis is a muscle of thenar eminence that is supplied by median nerve. Abhishek, right. Median nerve. Abductor pollicis brevis is supplied by median nerve. Adduction of the thumb. Adduction of the thumb is done by adductor pollicis. Adductor pollicis and the first palmar introsci. Adductor pollicis and the first palmar introsci. Who's going to supply this? Ulnar nerve. Ulnar nerve. And the last one is opposition. Opposition is done by opponent's pollicis supplied by median nerve. Median nerve. So this should be very clear. This should be very clear. Okay, so you get plenty of MCQs and students are always confused on this, and the nerve supply, the muscles producing movements and the nerve supply. So I've enumerated this for you. This should be clear to all of you. Okay, come on. We'll go to the next slide, students. We'll go to the next MCQ here for you. Right? Chilo. Fine, I'll go to the next MCQ. Identify the pointed structure here. And this is a special MCQ for you. This is a special visual slide, students. This has been asked in AIMS also. Long back this was asked in AIMS also. Come on, students, if you can identify the pointed structure. Yes, very good. Upendra Gaikwad, very good. Anyone else? Identify the pointed structure. That's the sympathetic chain. Yes, you got this right. That's the sympathetic chain. So, that's sympathetic chain. Excellent. What is this? I'll just magnify this for you, students. I'll just magnify this for you. And you can quickly tell me, what is this? You can see the pointer now. You can see this. That's the carotid sheath. That's the carotid sheath. That's the internal jugular vein. That's the internal carotid artery. And what is this? Nerve in the carotid sheath. Can anyone identify this? The nerve in carotid sheath. The internal jugular vein, the internal carotid artery, and what's this nerve? What's this nerve? The vagus nerve. That's the vagus nerve. Vagus. There's someone lying on the anterior wall of carotid sheath. Students, he has not drawn that, but I'm just asking you. There's someone lying on the anterior wall of carotid sheath. What could that be? Any guesses? He's not drawn that. I'm asking you. Posterior wall is sympathetic chain. Anterior wall of carotid sheath. There's something. Can anyone answer this? This is a very important visual slide. The previous slide was a very important visual slide. Yes, you got that right. That's ansa cervicalis. Yes, that's ansa cervicalis. So anterior wall of carotid sheath, what lies is ansa cervicalis. The posterior wall of carotid sheath is related to the sympathetic chain. That's the thyroid gland here. That's the trachea. That's the esophagus. And students, if you can quickly identify this structure which lies between the trachea and the esophagus here, what is that? What is this structure on both the sides? Any guesses? It lies in the tracheoesophageal groove, students, the tracheoesophageal groove, and that's the recurrent laryngeal nerve. The recurrent laryngeal nerve. This is the recurrent laryngeal nerve in the tracheoesophageal groove. Fine. Identify this muscle. That's the sternocleidomastoid. What is this muscle? That's the trapezius. That's the trapezius. Okay. So that's the trapezius. That's the sternocleidomastoid. What is this area? That's the posterior triangle of the neck. What is this area? That's the anterior triangle of the neck. Now, these muscles are going to form the floor of the posterior triangle. The boundaries of the posterior triangle would be the sternocleidomastoid, the trapezius. The floor would be formed by these muscles. And what is this fascia which is going to cover the floor of the posterior triangle? Yes, students, can anyone answer this? What is this fascia which is going to cover the floor of the posterior triangle? That's the prevertebral fascia. That's the prevertebral fascia, which forms the floor of the posterior triangle. What is this muscle here? That's the scalenus anterior muscle, and there's a nerve lying on the scalenus anterior, and below the prevertebral fascia, this is going to be the phrenic nerve. That's the phrenic nerve. Okay, so the phrenic nerve is lying in direct contact with the scalenus anterior. The phrenic nerve is lying below the prevertebral fascia. This is the scalenus anterior, that's the scalenus medius. Between them lies the brachial plexus. That's the brachial plexus. Between the scalenus anterior and the medius lies the brachial plexus. Perfect. Okay, what is this space behind the pharynx here? What is the space behind the pharynx? This is the retropharyngeal space. Retropharyngeal space. And the space in front of the vertebrae is known as the prevertebral space. Prevertebral space in front of the cervical vertebrae, and behind the pharynx, that's the retropharyngeal space. Retropharyngeal space. Okay, that's it. So what is this in blue? What is this blue colored fascia? That's the pretracheal fascia. Pretracheal fascia. This is the prevertebral fascia, and the one which is going to enclose the trachea and this muscles here, that's the investing layer of the deep cervical fascia. Investing layer. So these are the various parts of the deep fascia of the neck: the investing layer, the prevertebral layer, and the pretracheal layer. Pretracheal layer. Perfect. Perfect, students. Can anyone tell me what is the root value of phrenic nerve? Root value of phrenic nerve. Yes, quick. What is the root value of phrenic nerve? That's C3, C4 and C5. C3, C4, C5. That's phrenic nerve. And there is an extra phrenic nerve which we call as the accessory phrenic nerve. Accessory phrenic nerve. Very good, very good. And this accessory phrenic nerve arises from C5 root of the C5 root. Accessory phrenic nerve. There's sometimes an extra phrenic nerve which we call as the accessory phrenic nerve, and it arises from C5 root. C5 root. Okay. And this phrenic nerve lies on the scalenus anterior muscle. Can anyone tell me what is the relation of phrenic nerve with the hilum of the lung? What is the relation of phrenic nerve with the hilum of the lung? It goes in front of the hilum of the lung. The right phrenic nerve goes into the abdomen along with the IVC at T8 vertebral level. This you know. So the right phrenic nerve enters the abdomen along with the IVC. The left phrenic nerve directly pierces the diaphragm and enters into the abdomen. Okay, it pierces the diaphragm. And both the phrenic nerves would supply the diaphragm from the inferior aspect. They supply the diaphragm from the inferior aspect. Perfect. Very good. Okay, we'll just go to the next MCQ. Students, if you can answer this. Okay, one moment. Before I go to the MCQ, let us quickly let me brief you about a platform that we have for you. Students, so especially for you students, the All India PG 2022 mock test, All India mock test NEET PG 2022 All India mock test rescheduled to 26th of February on demand. Okay, 26th of Feb, 9 a.m. The final chance before the final exams, right? So do give this exam, the All India mock test. Now there's a special offer for 3 months subscription. You get 1 month free, students. We've got the plus subscription in which there are daily live classes, live quizzes, learning from the top educator, access from the device of your choice, and now you can also access to the question bank. An iconic subscription where you get the best of Unacademy and an iconic subscription where you get the best of Unacademy and pre-platter. These are the FMG toppers, the recent FMG results which were declared in December. We congratulate all of them once again. So we've got an educator curated test series, students, specially for you, subject wise test series, educator curated test series. Just have a look at them and do give this. Okay, it will be beneficial for you. So here it is. 9th of Feb is over. 10th of Feb, 11th, 12th, you can just have a look at the website. Okay, all this. Some special class features in which there are daily live classes, interactive live classes, poll for the learners, raise a hand, never miss the class with proper notifications being given. And if you miss, you get the lecture notes in the form of PDF, and anytime, anywhere you can access the class and get your doubts solved. Students, especially for you, for the NEET PG 2022, our special revision batch from all the educators under one roof of Unacademy. All the educators of Unacademy under one roof are going to have a quick revision just before the final exams. Okay, it's an all educator revision batch, and yes, we are waiting for that. The Focus FMG 2022 comprehensive batch is beginning from 11th of Feb, and the Focus FMG December 2022 comprehensive batch from 11th of Feb. The Target Next 2023 subject wise batch from 11th of Feb. Lot of new batches coming up. Download the Unacademy app and subscribe to it. And students, the iconic prices have further slashed down. You can just have a look at this. They have slashed down. Avail this benefit of the price slash. Okay, we come back to the MCQ. Students, I'm not done. Just wait. Chalo, we'll discuss this and we'll wind up for the day. A 55-year-old woman with a history of severe depression is present to the emergency with having a cut deeply into the flexor retinaculum of her wrist at the level of carpal tunnel. She has no sensations on the palmar or the dorsal aspect of the distal and the distal part of the middle and the index finger, and half of a ring finger which has been compromised. Can anyone answer this? Yes, that's the medial nerve. Medial nerve. Very good. That's the medial nerve. Can anyone tell me, at the wrist, you have got the tendon of flexor carpi radialis at the wrist. If I go lateral to the tendon of flexor carpi radialis at the wrist, what do I find? If you can just answer this. Look, that's the wrist. The tendon of flexor carpi radialis goes to the, it crosses the wrist and goes to the hand. If I just go lateral to the flexor carpi radialis, what do I find? Very good, Shasti. I find the radial artery. And if I go medial to the tendon of flexor carpi radialis, what do I find, students? Medial to the tendon of flexor carpi radialis, what do I find? Can anyone guess this? Lateral is radial artery. Who's medial to the flexor carpi radialis? Are you following this? Here dekho, if I'll just make a small, and that's the tendon of flexor carpi radialis. That's the palmaris longus. If I go lateral, Shasti, if I go lateral to the tendon of flexor carpi radialis, I find the radial artery. And if I go medial to the tendon of flexor carpi radialis, between the flexor carpi radialis and the palmaris longus, what is this structure? Between the tendon of flexor carpi radialis and palmaris longus. Yes, I do get something. Anyone? What is the structure between the flexor carpi radialis and the palmaris longus? That's the medial nerve. Don't forget that. That's a medial nerve. So if I had to find the medial nerve, if I have to find the median nerve at the wrist, very simple. What do? I just trace the palmaris longus tendon. I can identify the palmaris longus because it's a very it's a long tendon. The muscle has got a long tendon, so I identify that palmaris longus. Just lateral to the palmaris longus I go, students, and yes, I get the median nerve. And go further lateral to median nerve, I get the flexor carpi radialis tendon. Further lateral to the flexor carpi radialis, I get the radial artery. Radial artery. Is this clear, students? This is clear. And see if you can quickly answer this. Just the last part before I stop. I'll just make this for you. The hand. Here. That's a thenar, that's a hypothenar eminence. These are the phalanges that I just drawn for you. And tell me the cutaneous nerve supply. The cutaneous nerve supply, if you can answer this. The cutaneous nerve supply of the hand. Chalo. Tell me who supplies the skin over the thenar eminence. Who supplies the skin over the thenar eminence? That's the palmar cutaneous branch of median nerve. Who supplies the skin over the hypothenar eminence? That's the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. Now, who's going to supply this 3.5 fingers on the medial aspect? Sensory cutaneous supply. 3.5 fingers on the palmar aspect would be supplied by whom? Median nerve. This is the median nerve. 3.5 fingers are supplied by median nerve. Palmar aspect, the same median nerve goes to the dorsal aspect, supplies the distal phalanx, distal and middle, and distal and middle half on the dorsal aspect. That's the median nerve. So median nerve supplies 3.5 fingers on the palmar aspect. The same median nerve goes to the dorsal aspect, again supplies 3.5 fingers, but not the proximal phalanges. Not the proximal phalanges for this 3.5 fingers. Tell me, students, this 1.5 fingers on the palmar aspect is supplied by whom? This is supplied by superficial branch of ulnar nerve. Superficial branch of ulnar nerve. The same superficial branch goes to the dorsal aspect, supplies the distal phalanx and the middle phalanx, except the proximal phalanx of 1.5 fingers. Easy? This is clear to all of you? So, what is the median nerve going to supply? 3.5 fingers here, 1.5 fingers is supplied by the superficial branch of ulnar nerve. On the dorsal aspect, 3.5 fingers except the proximal phalanx, median nerve, 1.5 fingers except the proximal phalanx, the superficial branch of ulnar nerve. Now, tell me who's going to supply this proximal phalanges of 2.5 fingers. 2.5 fingers proximal phalanges and the dorsum. This is supplied by whom? This is supplied by the superficial branch of radial nerve. Superficial branch of radial nerve. And now one last thing. Who's going to supply this 2.5 fingers here? This is anyone? This is the dorsal cutaneous branch. Dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. That's it. Just remember this. This is a very important MCQ, a very important options which comes in the exams. Okay, I'll just repeat this for you, students. Look, the palmar aspect, dorsal aspect. Palmar aspect is very easy. The skin over the thenar eminence is supplied by the palmar cutaneous branch of median nerve. The skin over the hypothenar eminence is supplied by the palmar cutaneous branch of ulnar nerve. And both these nerves go above the flexor retinaculum. 3.5 fingers on the palmar aspect, median nerve. 1.5 fingers on the palmar aspect, the superficial branch of ulnar nerve. Perfect. Superficial branch of ulnar nerve. Coming to the dorsal aspect. 3.5 fingers except the proximal phalanges. Except the proximal phalanges. 3.5 fingers, medial nerve. 1.5 fingers except the proximal phalanges. That's the superficial branch of ulnar nerve. 1.5 except the proximal phalanges. Superficial branch of ulnar nerve. The proximal phalanges of 2.5 fingers and the dorsum. 2.5 and the dorsum. This is supplied by the superficial branch of radial nerve. Superficial branch of radial nerve. And 2.5 and the dorsum on the medial aspect is supplied by the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. Is this clear, students? I hope this is clear to all of you, students. If there's anything not clear, you tell me. Okay. Fine, students, clear to all of you. So I hope everything is clear. You've enjoyed the session. Thank you for this interactive session and patient listening. We'll meet once again with some more MCQs and some more visuals for you, students. Thank you to all of you and good night. Thank you. Any doubt anyone has? Yes? I hope this is clear. This nerve supply is very important. Nerve supply of the hand is very important. Cutaneous nerve supply. Plenty of options also you get in the MCQs. Okay. Thank you and bye bye. Thank you. I'll stop here.